So what is generative medicine? Just generally, that's the fellowship society that I am, and this is the type of medicine we do here. Pretty much it's just evidence-based medicine. Everything we do here has some kind of scientific basis. So we use something called systems biology and bioinformatics. So we take all this data, we crunch it down, and we use it to treat the patients. That way we can have good care when you're seeing an allopathic doctor, when you're seeing the middle person, and you're seeing a naturopath. There's good communication, and they're getting an effect. So I'm not saying like, oh, I'm going to give you lavender. I'm going to tell you exactly why I'm giving you lavender from our point of view, but it doesn't mean that it doesn't work over here either. It works all over the place. I mean, you'll notice that in this building, if you have a chance to look around, there's a lot of different clocks all over the place. There's 20 plus clocks in this building. Upstairs in the room right above us is the conference hall. We have all the students in there. I think there's 8 clocks in there. We'll have them all going on at different times, and cuckoo birds coming out and everything.
Oh my God.
It's amazing. You block out the noise after a while. When you get used to it. I'm always up there when I'm on shift and I turn them all on and everyone's like, ah. But Dr. Vidalma has them up there because from the allopathic point of view, the medical doctor point of view, there's little gears and knobs in there and that kind of stuff. And I can investigate that clock to a certain level and I get down to that cog or that spring. And that's all I can understand from that. But they can't take a step back and realize that they can't tell the whole from the sum of that part. You need to look at the whole thing, you need to look at the whole, the cogs, the face, everything to understand that's a clock and how it works together. So that's kind of the holistic approach, and that's why there's clocks kind of all over the place. I guess my treatment philosophy, I do 3 things with all my patients. I give the body what it needs, I take out the trash, and I increase vitality. So giving the body what it needs is diet, minerals, vitamins, supplements, energy, love, whatever it is, I'm giving the body what it needs. And that's going to be an individualized approach. Taking out the trash is kind of that detoxing period. I make sure you're sweating, make sure you're pooping, I make sure you're urinating properly. You're dreaming, so you're detoxing from the brain that way. Anything along those lines, vitality. The easiest way to explain that is the sparkle in your eye, is the kind of your life force. It makes you want to get up there and go and be full of energy and life. And that's usually a little bit harder with people to get going, especially if they're in a chronic kind of sick disease, but it's a very important one. You can have, if you have nothing else, increasing vitality is going to be the most important thing. Because if you have a will to live, you're going to want to live, and you're going to want to get better. Alright, but it all started with blood type. So kind of now into more the introductory period about 10 things you probably never knew about your blood type. It all started back with an Austrian doctor named Carl, a scientist named Carl, who discovered that blood type A, blood type B, blood type O, blood type AB, if you put them together, weird stuff happens to the blood. They start to have fireworks and weird things happen to blood, and that's where the medical understanding came from. Now, I need to do a transfusion, so I'm going to give you this blood and not that blood, otherwise you'll die. That's pretty much the only understanding that medical doctors have and osteopathic doctors have of blood type at this point. Because it's very important. You don't want to give someone the wrong blood because they're going to die. But it goes into a lot more detail than that little part. As we can see here, if you go into any Quest labs, you go upstairs in our lab, or anything along those lines, you'll see one of these charts on it. Just pretty much if you're blood type A, you have little A things on your cells. If you're blood type B, you have B things on your cells. AB has AB on their cell, and O has nothing on their cell, or 0, as they say in Europe. And your body's going to bind to those, and it's going to cause agglutinations as things come together and explode if something bad's going on. So going into 10 things you never knew about blood groups. So things without blood can have blood types. This goes from viruses, bacteria, fungus, and yeast. This is why when I tell a patient that if you're a certain blood type and there's a cruise ship that just had an outbreak of the norovirus, go on that cruise, you will not get the norovirus. You'll be completely safe and it'll be a very cheap cruise. Because you're coming up as a Lewis A blood type. You cannot get the virus because you can't stick to it. And that has to go with everything. If you're blood type O, you're more likely to get candida infections, yeast infections, stuff like that. If you're blood type A, you're more likely, I think it's like staph and strep infections. And there's different predisposition to diseases just based on your blood type, which I found amazing. Like if I know I'm more predisposed to get the flu or there's a certain strain of flu, I gotta make sure I have good on my elderberry and all my other stuff so I prevent getting the flu that year. Number 2, they're all over the place. Anywhere your body kind of interacts with the outside environment, your blood type's going to be there. Mucous membranes, your eyes, ears, your vaginal fluid, your semen, your sweat, that's going to have blood type in there. That's because your body's interacting with the outside world. So there's going to be an immune system there. Because you don't want a bug to come in and then your body can't do anything with it, and you have an infection from it. So your body is there. It needs to be in that good, nice environment. And there's a whole bunch of different blood types. You heard me say a little bit earlier that there's 295 blood types. There are 295 blood types. There's the ABO system we know about. There's the rhesus-Macaque system, which is that positive negative. It actually comes from a monkey. So a lot of people know I'm blood type O positive. So ABO, I'm O, and the rhesus factor, I'm positive. But there's also ones called NN, Lewis, Duffy, and there's about 295 others. The most important ones are the ABO and the RH, especially for blood transfusions in the medical world. Secretor status, or the Lewis blood type, is very important as well. That has to do with a certain gene. If you have this gene, that means you have this blood type. It means you're more likely to get this disease or not this disease or this kind of deal. But they're probably the three most important ones. You know, we talked a little bit about this. You know, most understanding from my colleagues that blood type is only important for a transfusion, which is very well it is. But it also has to do with more antibodies, which are things that your body goes on and attaches to viruses and bugs and makes them agglutinate and all this weird stuff happen. It's important for that, as you know. They control how you hold yourself together. You know, it's how stuff sticks together, how stuff sticks to your cells. That's why certain blood types are more predisposed to cancers and stuff like that. Because they like things to stick to themselves. And if they stick to themselves, then that tumor can kind of root and can kind of grow from cancer at that point. You know, it's one of those things, we all have cancer inside of us right now. There's a normal process. You have a cell that's going to kind of mutate it, your body's going to go in and kill it off. That's what it does. The problem is when you get really sick and you can't do that anymore, that's when problems happen. So we want to prevent that from happening. If we know that you're a blood type A1, if you're blood type A1, because there's different types of blood type A, if you're blood type A1, you're more predisposed to having cancer. If you're blood type A2, you're more predisposed to having heart diseases and stuff like that. So just knowing that little bit of information right there is perfect. And all these tests can be run through Quest Labs. And the same thing with the developing embryo. You got to imagine that you have a little guy kind of sitting in your uterus, kind of growing around, and the cells need to stick to each other so you can get the head in the right spot and the arm in the right spot and all that good stuff going on. So blood groups are actually going to determine how that stuff kind of binds together. Your gut, very important. Blood type actually has a lot to do with your gut. You know, from different infections like H. pylori and parasites and stuff like that, it has to do with the amount of stomach acid you have. So if you're a blood type A, and even better if you're a blood type A secretor, so that means you're Lewis B positive, you have a high amount of stomach acid. And because you have a high amount of stomach acid, you're better off eating a lot of meat. A lot more meat because you have all the stomach acid sit there. You need to put some animal protein in there of some sort, you know, fish, turkey, grass-fed beef, anything along those lines to kind of use up that stomach acid so your body can absorb it and pass it down. That also means that blood type O's have a higher amount of cholesterol, which is a good thing in a blood type O. It's a good thing in blood type O because they have another enzyme called intestinalized alkaline phosphatase, which actually heals up your gut. So they have a lot of cholesterol, they're going to heal up the gut, and they're going to use that cholesterol for that process. So if I have a blood type O coming to see me, their cholesterol is about 250 or under, I should say under 250, I'm not worried that they have good cholesterol or HDL. If the blood type A coming with me and they're above 200, yeah, I'm worrying a lot more because they're more predisposed to heart disease and all that good stuff. So the amount of stomach acid is going to really depend on your health history. So even the blood type A has less stomach acid than anyone else. So that's why they do relatively well with more of a Mediterranean, fish-based, vegan, vegetarian diet. They predict many different types of food reactions, so how your body interacts with your food. There's something called a lectin. A lectin's got this kind of little receptor on the cell. If you can imagine, I have a box here, and in that box I'm going to put a whole bunch of tennis balls in that box. And I'm going to cut up little Velcro strips, and I put those little Velcro strips in that box with the tennis balls, I'm going to shake it up, and I'm going to throw it down. And it's all going to come out in one giant clump. And that's the Velcro is acting as a lectin, and everything's binding to it. And everything binds to it, the body's going to be like, well, this is foreign, because this looks funky. And it's going to go in there and attack it, and you're going to have a food reaction to it. If I take that same box and I put a whole bunch of baseballs in there with the Velcro and I shake it up, most likely that Velcro won't be sticking to too many baseballs. There's only a little tiny like seam in the baseball that this stuff can stick to. So your body's less likely to attach that. And that goes into, there's certain fruits and vegetables that are good for you and are not good for you. You know, me speaking personally, I cannot have kidney beans for the life of me, but I read all this good stuff about kidney beans. Avocados are a great example. There's a whole bunch of research coming out right now. Avocados are good for treating a certain type of cancer, leukemia. There's one chemical compound in that. Not for blood type O's, but for blood type A's. Blood type A's have more predisposition for cancer. And they're supposed to eat more avocado. That makes sense to me. Like, that's putting more pieces together to the puzzle. And it's very cool that these little lectins, which is everywhere if you like looking at science or scientific literature like me, or Dr. Diadawa or anyone in this building for the most part, if you read any study, they had no idea what it is, what the substance is that they're trying to get. They add foods to it to see if it agglutinates or it clumps together and kind of explodes. It's the same way we figure out your blood type. So if you don't have your blood type and you come back in for a 5-minute thing, we'll do your blood type for you. There's actually little food dots that are on the card itself to do blood type, and you put your blood on there. If it agglutinates, you're a certain blood type. If it doesn't, you're not that blood type. And that's what they use everywhere. They use like Quest Labs, LabCorp, any of those labs to figure out your blood type. You know, lectins in nature, you know, about 50% of the fruits and vegetables that are out there are going to have lectins on it that are going to bind to your blood type and cause inflammation and problems to be associated with that. It's tremendous. You can see in the next slide, the one on the left, on your left, is a normal blood, how it looks if you look at a little dot. And the one on the right is what happens when they start clumping together. So they're very clumpy, and that's called agglutination. That is bad. When you eat foods that you're not supposed to eat, that's what happens to your blood. If that happens to your blood, you're not getting the oxygen you need, your immune system's not properly being activated and sent to the right places and all that stuff. So this is also one of the reasons that can make you a little bit more obese, overweight, is if you're eating the wrong type of lectins. I love cucumbers for the life of me, but I cannot eat cucumbers because I have bad GI problems with that. But that's supposed to be a good fruit, good vegetable, right? It's supposed to be a good vegetable, but not all vegetables are created equal for every blood type. So there's certain people that do really well with them, other people that do not. And that's really what we go into with the diet and all those recommendations that we do there.